Assalamu alaikum warahmatullahi wabarakatuh. My name is Galwanga Marvin. I'm working with Dr. Muhammad Ghulam Rabiul Alam from Dhaka University, Dhaka, Bangladesh. I'm presenting our work about explainable feature learning for predicting neonatal intensive care unit admissions. This is the outline of our presentation. Now, I would like you to first meet Joe, baby Joe. Say happy birthday to baby Joe. Yeah, Muhammad Ali said that everyone has a plan until they are punched in the face. Of course, all mothers are going to be happy while pregnant, but when these kinds of instances happen to them, this is when things go berserk. Things turn out to not be that good. Yeah, the only way to keep baby Joe alive is by keeping him in the NICU. And for this one here, that means that Mama Joe has to come and check on him, say good morning and good night. Then baby Joe goes back into the NICU. She has to pay for all these expenses to keep baby Joe there. Now, Mama Joe is not alone. Mama Joe has colleagues, also have babies in the same kind of situation. Joe also has colleagues who are in the same kind of situation. All these kids are in pain, and all these mothers are in too much pain. Now, at American International Hospital, Joe is receiving the following services. He's receiving all those services that you do, the presence of the doctors, the trained nurses, the HITV vital station monitors, and lots of other services. The question is, do you think Joe is still in too much trouble? Will he leave? Why is Joe in the why is Mama Joe and Joe in ICU? Because of premature births, because of respiratory distress syndrome, and this happens to most of the so this whole thing of hypoglycemia, prenatal depression that usually causes NICU admissions is a very huge problem. And this means baby Joe is in deep trouble. He's in pain and he's in misery. Will baby just really survive? Mama Joe is so worried, he's so stressed, and she has nothing to do other than praying for Joe and watching over him. Let us fly to a low resource setting and see what happens. Away from American International Hospital, we move to Bangladesh and we meet Mama Buju. Mama Buju is one of the ladies who is actually pregnant, and she also needs those kinds of services. Not that, yeah, she's also pregnant. She also needs some good quality services. But this is what happens in case of emergencies, low resource settings. Actually, that's why high mortality rates are so high. These people die because all those people you see there, the ladies, they all have to save their lives. They also want to live. They want their children to live. They all want to live a better life. Now, for NICU in all settings, that's what they look like. They are way much more. The situations are indeed they are resource and they are constrained resource settings. So the problem is neonatal mortality. For this one, even if you just jump onto your device before you even complete the word, they will tell you of how mortality rates are too high, and in Bangladesh as well. So it's a big problem. The summary that the maternal mortality is on a big rise, is on a rise. Morbidity, maternal mortality, maternal morbidity. You have to imagine serious reactive medicine is not effective enough, expensive NICU and the black box predictive technologies towards for solving these kind of problems. It's causing a lot of pain, a lot of uncertainty look to within it and everything. And existing works towards internal medicine is this. Is that's what you see. The thing is, all existing works of about towards internal medicine are they are extremely patient-centered. Medicine is just reactive. It's reactive neonatal medicine, and it expensive IoTs for monitoring and for patient fetal monitoring just to prevent NICU admissions is also very expensive. So the statistical and machine learning models that exist to predict these things are also extremely they are black box. The thing is generally all existing works are focused on reactive medicine and prediction of survival of units in the NICU. There is no transparent, trustable approach to internal predictive medicine. The problem is expensive, uncertain, patient-centered, risky, reactive approaches to maternal and neonatal medicine. And the solution we are proposing is that what if you could borrow the idea of predictive medicine? Well, what if we could leverage the healthcare data that we will have to actually implement predictive medicine? Here we shall be predicting the NICU admissions, and we explain why it is likely for someone to get admitted into the NICU. That means that we give you a chance to proactively take action in order to prevent it, or to proactively take action to prepare for it. And for this, we are demystifying the black box by actually explaining the models using various methods. And for what we did that we first did this, we chose three models. We used random forest, and initially the accuracy was 75, we tuned it to get 77% accuracy. Then for logistic regression, accuracy was 69%. And for support vector, the accuracy was 69%. And those are the predictive results that you see there. Yeah, for model selection, in this domain of medicine, we actually chose precision. We actually chose recall as our metric for model selection. Reason being, we are mainly dealing with safety. We're dealing with life. Why did we choose this? We all know that recall is simply a fraction of the relevant instances that were retrieved, and recall is the opposite of precision. It just measures, recall measures the positive, negative, the false negatives against the true positives, and these false negatives are especially important to prevent disease detection, and they're also very important in predicting, in all predictive approaches that involve safety. Accuracy is just a degree to which the results conforms to a correct value, but it's not that important. In this case, okay, it's important, but it's not that very influential when it comes to safety. Likewise, precision, which is the quality of being exact. So those ones are, that's why we actually chose recall as our metric for selection. So we want on to demystify to understand that, like the different contributing features for feature importance. And here we saw that these features that you see are weight, hemoglobin, preterm, treatment, hours in labor and age, those are the most contributing factors to that influence or that contribute in NICU admission. So medics can make a decision based on those kind of factors, but that's not enough. Because for interpretable and explainable artificial intelligence and artificial learning, we use different models, and one of them was the sharp additive explanations. Sharp additive explanations they just provide a different test of importance. Reason being, we then provide you with the important features based on their interaction for a given patient. So we are displaying for you a sharp summary plot. And for this particular thing, I can honestly tell you that it's not the same. Feature importance is not the same as feature learning, and therefore they cannot be the same. Even when they look to be the same, they are not the same. Because for this case, a medic for feature importance, the C section you see here was at the bottom, which didn't seem to be important. And yet, for when we did explainable feature learning, it popped up to be one of the most influential features to NICU admission. So if a medical personnel makes a decision, a medical decision based on feature importance alone, is not sufficient enough. Therefore, explainable AI is the most appropriate approach for NICU admissions and any kind of medical decisions. We go on to diagnose and open and understand more of these predictive models, because you know that the model can be able to make the right decision or correct prediction, but for the wrong reason. So here we use LIME in order to understand the agonistic interaction of the features, and also to be able to plot and understand whether the model is really making the right decisions or the right predictions for the right reasons. And we also use the explainable AI in order to understand the coefficient contributors for NICU admissions. And there in the image, you see that green is to a higher positivity, while pink is to a higher negativity of admissions within the NICU. The question is, which would you trust? Logistic regression alone or an explainable approach to logistic regression? What if you are Mama J's family doctor? Which one would you choose? Which one would be the better decision for you? In this work, we leverage artificial intelligence and machine learning. We apply to computer science and data engineering techniques for proactive, predictive, preventive, and personalized medical approaches in order to be able to detect NIC admissions and to be able to provide insights that could be able to guide the users on what decisions they can be able to make, most especially the physicians. So with our model, the physicians can understandably trust, comprehensively assess, and transparently analyze the different features that contribute to NIC admissions before they make any kind of medical decision. In conclusion, we predicted all the miserable consequences as a result of NIC admissions using machine learning, which was applied in healthcare. Then mainly to avoid the uncertainty, the increasing costs of NIC admissions, and death mainly. The mortality is to cure people, to cure all these people of the pain they are going through. In our future work, we are hoping to develop a standardized, explainable NIC admission evaluation management framework for patients and neonatologists. But we are also requesting that other researchers simply jump in to try out and navigate the other possible causes, of NIC admissions, because there is still more to this whole thing of NICU admissions. We believe that with explainable feature learning and the intensive care admissions, we can make this world a better place. Thank you so much for listening to me. We believe that explainable AI is a feature for all medical decisions. Assalamu alaikum warahmatullahi wabarakatuh.